Welcome to Jones Physical Therapy Patient Stories. This is our Faces of Endo series. I'm Liz Jones, owner and pelvic health physical therapist. This March, in honor of Endometriosis Awareness Month, we are shining a spotlight on the journeys of women with endo. We'll hear about their journeys, challenges, their wins. So anyone who thinks they might have endo or is already on that path can feel seen, supported, and empowered. You're not alone, and these stories are here to inspire and educate. Today, we welcome Kristina. She's honestly one of my favorite stories, and she's always been so gracious in letting us share her video from Dr. Duke. So thank you. I had the honor of joining Kristina's journey in 2022. And you may see her sweet little one in the background, who's kind of actually a fun part of the story in joining us. So Kristina, can you have everyone do a quick little stat sheet, like a recruiting sheet is what I call it. So give our listeners just a quick stat sheet.
So I'm 39 years old. I'm married. We have 4 kids, ranging from 18 to almost 2. And it has been quite the 3 years. It's gone by so fast. I just can't. It's hard to fathom how quickly things have changed and gotten better when I was in such a hard place for so long.
Yeah. So Kristina is 3 years out from excision surgery with Dr. Duke. So let's go back to the beginning of your journey with Jones PT. What were your symptoms that brought you into our clinic, and what doors opened after that?
So I first came to you in August of 2022. I had seen a pamphlet for the hemorrhoid procedure during my yearly checkup. And I asked the lady, like, does this work? Because I was miserable. I was working 12-hour shifts, and I was in so much pain. I was just absolutely miserable. I'm like, okay, let's give it I gotta do something. So I came in, filled out the intake sheet, and that was probably like the turning point of life right there, because I was 35. I was working a shift job. So I was working 4 12-hour day shifts, 4 days off, 4 12-hour night shifts, and then like 3.5 days off. I'd had 2 miscarriages at that point. They had started me on thyroid meds to see if that was a possible cause of the miscarriages. But I had been having painful, heavy periods for so long. Oh, we're gonna have more. I had chronic fatigue and brain fog, and it was really hard to not be there for my kids, not be there for my husband. I'm struggling at work, and all my coworkers are like, "What's your deal?" Mm-hmm. Like, just go home and sleep. But I couldn't sleep. I had insomnia. I could only sleep for 4 or 5 hours at a time. It didn't matter if I was up for 24 hours or if I was up for 12. I was miserable. I had been seeing a naturopathic doctor to try to help, but it was because of where I was in life. It was like, here's a bunch of natural uppers, and here's a bunch of natural, here's to boost you up, and here's to help you sleep. My cycles were so painful, and so just whole body involved. It was like I was going through mud at work. My coworkers would be like, "Are you okay?" It's like, I'm just getting through. But I had so much inflammation. My elbows hurt, my knees hurt. I had pain just radiating down my legs. And if I didn't actually take some sort of pain medicine, I mean, it was just 2 days of just completely miserable. If I had a bowel movement during the first couple of days of my period, it felt like somebody was trying to rip my uterus out with pliers. It was just awful. Like, you shouldn't dread having to go to the bathroom. But I did. It hurt so bad. And then after the fact, looking back, I mean, I had such endo belly. I had so much inflammation. Like, I could look 5 or 6 months pregnant, because my stomach would just get so big. I have to have different pants. And it was so hard.
So you thought you were coming here for hemorrhoids, and then you filled out your intake and we started talking. Had you ever heard of the word endometriosis before you'd been here?
My mom had endometriosis, and so I was aware that it existed. I feel like I was not well informed with it at all. Hi, honey.
I just wanted you to look at me.
She had her endometriosis surgery in the early 90s. So
Mhm.
I feel like that was just a whole different experience. Like everything, the way they treated it, approached it, everything. And so I was very surprised to hear, it was either from you guys or from another doctor, that if your mom has endometriosis, you have a 70% chance.
Yeah.
Because I've never seen a question on an intake form saying for your OBGYN that says, is there a history of endometriosis? There's cancer, heart disease, all of that stuff. Why is endometriosis not on that list if you have a 70% of chance of having it if your mom has it?
Yes.
And so whenever I had brought up pain cycles, we do fertility tracking. So I could show my stuff to the doctors and say, this is really long and this is when I have pain and my period lasts 9 to 10 days. And I don't know if that they didn't know what they were looking at, or there was, the only thing that I was told was, well, we can give you birth control to control your cycles. Well, to moderate your cycles, which of course it's not moderating your cycles. It's not even really cycling at that point. It's
Well, and we talk about that with the birth control, that in the dandelion analogy, it's like painting lawn paint over the weeds. So it can minimize some symptoms, but again, we know there's so many other detrimental things to birth control. And then, Christine, like you elaborated too, you guys do fertility tracking. So in the Catholic faith, the natural family planning, you don't have to be Catholic to do natural family planning, but in the Catholic faith, there's actually a huge morality issue with birth control, which sometimes I myself, it's hard to explain to practitioners sometimes that actually I don't want to be on that because of my faith also, right? So there's a lot of reasons where that is just not a great answer, especially when you want to get to the root of why is my body not feeling well? Why is my body doing this? And when I met you, you were still working and you were considering stopping working because you were like, I can't even mother right now. So you had talked with different doctors of just in general, the fatigue, the things like that. So we can carry on from that part.
well, and there's so many directions to go with that too, because like when I first saw, I hadn't seen a doctor, an OBGYN, for a while because I was very frustrated with how I was treated leading up to and following my my two first successful pregnancies, because it was, okay, you have pain, it's normal, here's birth control, this is basically your only option. Not even really like, oh, here's some hormonal options or anything. It was just, well, there's birth control. And then when after my son was born, my second pregnancy, they were like, well, what are you going to do for birth control? And I'm like, I'm going to keep doing my fertility tracking that I've done for the last however many years. I was successful through my first pregnancy and then nursing. And that's what I'm going to do. And they're like, well, that's not scientific. And my mind about exploded, because it's way more scientific than just giving me some pills.
Yes.
So I had a miscarriage in 2020. Oh, wait, no. Not 2022. It was 2020 and 2021. It's like, okay, you can chalk one up to miscarriages happen. The second one, okay, that's something's going on. So let's talk about what's going on. And they looked, there's the things you look at first. Like, does the man have issues? What issues do I have? Thyroid. But again, the conversation about endometriosis didn't come up, which, considering that's a huge symptom of endometriosis, that was a surprise. I forgot where I was going with that. But I have just so many feelings about even just birth control, because I was put on birth control when I was 16 to manage my acne. They were like, oh, this will regulate stuff, this will make it better. And I was gone at a 6-week summer program for high schoolers. And I had so much pain with that first quote unquote period. I was in my room bawling. I called home. I had never had so much pain with a cycle, you know,
Mhm.
cycle, not cycle, in my life. And I was like, I don't even know what's going on. And that was my first painful cycle. And that was the beginning of like just the end where it was just being miserable.
Mhm.
And I feel like when you look back through all my symptoms, what could have I done different? What could have I said different? Like,
Mhm.
how much information did I need to give in order for somebody to listen?
And that is a really defeated and disheartening part of it, is that, again, this is why the average to diagnosis is 7 to 10 years. And most of those women will see up to 6 practitioners before they hear the word endo. Which,
Yeah.
again, when I say the nature of how we treat here, we step back, we look at the whole picture. We have the ability to do that. And if someone's not coming to us with an emergency, my thyroid's all over the place. It's this general, I'm not feeling well. And then we start going into all of it. So we do have the privilege of being able to do that. And that's where someone like you, who comes in with a lot of people come in for hemorrhoids or incontinence or just pelvic pain or pain with intercourse, and they've never heard the word endo. So once we talked about, no, like this, a lot of your symptoms could be from endo. How some women, it's validating. Some people, it's almost like harder to hear because you're like, are you kidding me? Something was causing this the whole time and no one figured it out. Like, where were you at when we first talked about it? And then get into the how your feelings were around surgery and in that whole process.
So after processing that and like looking more into it too, and just looking at your guys' spec sheet about endo, it's like, on one hand, I was so relieved because I'm looking at my coworkers who are the same age as I am, maybe a little bit younger, maybe a little bit over. I have so much brain fatigue that my 4-year-old is completing my sentences. I'm an intelligent, educated person, and I couldn't explain myself at all. I was tired all the time. But to know, okay, there was something else going on that I had realistically no way of knowing. And it's like, that I'm not crazy. I'm not a wuss for getting hit when I get hit with that pain. It's not that I'm a wuss and I can't hack it. It's a really big deal. And it was okay that I was struggling because I had things that I had to struggle with. I wasn't making a big deal out of nothing. There was a lot going on. And there was the alternative. I was just so mad. Because like we talked about, no one asked if endo runs in my family. All the symptoms were there. No one was looking at my charts. Like my chart, my cycles are super consistent in a bad way.
Like clockwork. All the red flags of endo are in my cycle.
Yes. And you can look at your charts and you can compare. There's a magazine called The Couple to Couple League, and they have like example charts of indicates not good. But you can only look, you want somebody that knows more than you than just, is this it? Is this not it? And overall, it's like, I'm 35, 34 at the time. And somebody made the comment to me, oh, this is the best age, right? Early 30s. And I was like, this is awful.
I don't know what's going on in your 30s.
You know, I am miserable. My life is in shambles. I don't know where to go. And that was the hardest part, because to be in that state of mind, to be in such bad condition, and where do I even turn to? Because how can I put all these pieces together by myself if I don't have anybody to go to guide me towards what is the end goal? I couldn't get past, how can I sleep? Like, how could I not be tired all the time? That was my first hurdle. I couldn't see to the end of the road. I didn't even know I don't know which direction that road was going. I was just, and that was hard. And then what was the...
So then when we started talking about gold standard is surgery. However, it needs to be out of state.
Yes. And that was scary. It's like, nobody wants to do surgery. I've had a bunch of surgeries. So surgeries, on one hand, it's just another surgery. Throw the IV in, swab everything, cut me open, okay, whatever. And on the other hand, it's like, whoa, this is going to be by far the most serious surgery I've ever had. And I kind of, I was, what did I say? I felt better about going out of state when my doctor, Dr. Merle, said, she's like, I can do your endometriosis surgery, but if you have it anywhere else, I can't touch it, which means I have to bounce you to another surgeon and potentially another surgeon, depending on where
if
it's
it's on
all at.
bladder, if it's on bowel, if it's
Yes.
And remember, you guys, she had significant bowel symptoms, so that's why we were very confident it probably was
Yes.
also affecting bowel.
Yes. And I know Dr. Natalie had said, your right ovary doesn't have a lot of blood flow. She's like, it's sticky, it's stuck to stuff. And I always had right hip psoas issues. And so it's like, well, why is the muscle so irritated? Probably because my right ovary had a bunch of endometriosis on it.
So the muscle's guarding.
So I had all these things that were tying into it that I would have never imagined were tying into it. And then going back to, okay, so everybody's recommending going to a specialist. And I'm like, we barely gone to Montana for for vacation, let alone Idaho or Minnesota or Georgia or any of these other places. And so that was a big hurdle. Me and my husband had to really wrap our minds around that. But then when it was time to start talking about going out of state, we worked with Dr. Duke, and his team was really great because we're going to be upfront with everything. You're going to know everything you need to know, and we're going to know everything we need to know before you leave your house. And that was so comforting to know. Even though it was, okay, this is nerve-wracking and stuff, we knew what to expect when we got there, and that helped so much. And then after finding out, okay, I had endo everywhere, and it was stage 4 endometriosis with an obliterated cul-de-sac, which I was like, what is that? So when you Google an obliterated cul-de-sac, all you get is journal articles that says how hard that procedure is to do, and you have to be an expert to do it, and how many hours of training. And I was like, oh,
this is why I go to someone.
Yes, it was.
Who's done a fellowship in this.
Yes, I mean, I was so thankful that that's where we went first, because it was one surgery. We were able to take care of most of it. He knew that our goal was to try to have more kids. So he's like, I had to leave some because I didn't want to take any risks of disrupting anything. But he was really good about that. Like he's talked about the video. The video's fun to watch every once in a while. And I remember coming out of surgery and he's like, how you doing? And I told him, it feels like I have my period. Which is probably what you shouldn't say after you've had a major surgery. And he was like, yeah, your uterus is pretty ugly. Yeah. But it's just, it was so good. I'm so glad I did it. And not to put lightly on the complications. But when I asked Dr. Duke, what if a bowel gets punctured? And he's like, then you go to your general surgeon and he was like, if this happens, we're going to know by this time and we can fix it. If this happens, you're going to know by this time and this person can fix it. Like he walked through all the things. And then one of the things was like, what if would I maybe have to get a colostomy bag? And he's like, well, maybe. It's like for like a month while whatever heals up. And I was like, oh, okay. But not forever. But he never came off as, he never blew off my questions. He totally understood that I was scared. And he is like, this is what I know. Gave me the answers I needed. And we were able to go forward.
Yeah.
That was nice. He never got upset by any of my random stuff.
He's very understanding and realizes women have usually been through quite a journey by the time they get there. For those of you listening, the cul-de-sac is actually this little area, this little pouch that endo loves to pocket in between the vaginal and the rectal cavities. So when women have it, and it's very common, endo loves to hide there. It can cause painful bowels, not every bowel movement always, but every once in a while you have a really painful one, which can also mimic hemorrhoids. That's why we end up catching a lot of endo here at the clinic. And then it can also be something with intercourse that if the penetration is at all posterior, women are like, ow, what was that? So it can be a really painful thing to have it there. From a standpoint after surgery, though, how much better are bowels now for you in digestion?
So much better. And talking about the intercourse, every once in a while it would be like, whoa, what just happened? It wasn't all the time, but it was just something's going on. And when or even after a bowel movement and you're cleaning everything up and you put pressure on
Just the perineum.
The perineum and stuff, and you feel it in the front. You feel it up by your belly button. And you're like, what's going on? I'm pretty sure this isn't right. But who do you talk to? And then by the time it's like, then you go on with life and you forget about it. But just having to have more complete bowel movements because nothing's stuck. Because realistically, I was already treating that part. I was seeing a naturopath, and at least the naturopath that I saw, the first question was like, how's your poop?
Yep.
And so we did so many things to get my gut balanced, figured out so I could have full bowel movements. But just the difference of just being able to go.
Right. Without having something obstructively there.
Yes. It's not piece by piece. It's just a whole clean out and you go on with your day.
And this is that chicken or egg thing. So many times women with endo end up having GI issues and SIBO and gut issues, part because they're not emptying all the way, part from the inflammatory piece. So either way, tell women when they're having constipation, bowel stuff, and GI issues, it's one of those things where you can spend a lot of time, appointments, and money on trying to fix your gut when no matter what, if you have endo, you've got this underlying disease in there that's undermining everything you're doing. Right?
Yes. Yeah. And that would have definitely been me because I was seeing a physical therapist. My pelvis won't stay square. My right hip is always turned out, and then my left hip is always off kilter. And it's like these muscles are always tight. These muscles are always pulling. And even right now, my uterus, since it's not attached to anything anymore, is pulling forward, which pulls on my sacrum, which because I have loose ligaments causes problems for me. But I know what's going on. I'm working with you and the other PTs here to build strength to help balance out those loose ligaments, to counteract that until I'm ready for the uterus to make its
And that's what's I share Kristina's story a lot with patients, not by name, obviously, but many women are in their younger years, they want to have children, their endo is horrible, and they also have symptoms of adenomyosis. Like in my story, when I worked with Dr. Duke, you have more adenomyosis symptoms than endo. We have to look at a hysterectomy. At that time, I had 5 children, and I was content with that. So I said, when you get in there, if it's healthy looking, leave it. If it's not, take it. Where in the cases for those of you who are like, but I want children, or I have some and I want more, that is definitely that conversation that, of course, they always respect your fertility first and strive to keep that. So and it's often, especially Kristina's was funny. It's like, that is an ugly, not healthy uterus and it needs to come out. So like you said, go on, have children, do all the things, but when you are ready. And the nice thing with that is you still have some symptoms you're going to have from the adenomyosis. But at least now it's like, at least your body can understand what you're feeling instead of this black hole of here I go again.
Yeah.
And then, like you said, we can work on things that can optimize your health as much as possible, knowing that your uterus is not the healthiest, but it's still in there doing its job, which is great.
Yes, I remember in the video, you could probably get 1 or 2 more out of it.
And the other thing is Kristina's, hers was crazy because her rectum was literally adhered to the back wall of her cavity at like a 45-degree angle. So like what should have just been like this movable, flexible colon that comes down, it was literally stuck to the wall at a 45-degree angle. So I remember he drew that on the picture and then showed it after. Look, now it's nice and straight and can actually flex.
Yes.
So it's no wonder bowels were hard and painful.
Yes. And looking at those pictures, I am a chemist by training. I don't like biology. It's not that I don't like biology. It was just never my thing. So I was looking at the pictures and even I could tell something was very different in the pictures. And it was just kind of amazing to see all the changes. And even just going back to my mom had endometriosis surgery and I've talked to people who've had where they get caught, the endo gets cauterized and stuff. But looking at all the pieces he cut out, he would circle it and say, this is endo and this. The endo was like 3 different colors,
Mhm.
and it was different textures,
Mhm.
and he took out, there was other connective tissue there. So you look at the pathology report and, okay, this was just tissue, but this was endometriosis. If you're not practicing this all the time, how are you going to know what you're looking at?
Yeah. Yeah.
And so just one more thing, where if you wouldn't go to your general surgeon for heart surgery or brain surgery, if you have extra things going on with your uterus, go to somebody that all they do is work in that
Excision
space.
surgeries. Yes.
Yes.
It is. And it's such a important piece of obviously your body, your life. So just real quick overview of after your surgery, you're 3 years out now. Give us an update on your fatigue levels, your ability to mother, to be a wife, fertility, bowel movements. If you could take a snapshot of your before picture to your after picture.
So I'm still tired because I have a 2-year-old. And I have a daughter that's graduating. And our pump on our washing machine just went out.
Right.
And my husband ran into something with her again. And those things are all stressful. But I would have crumpled as a human being if that would have happened back then. I mean, it was really bad. So just being able to be in a place where I can have all of this stuff going on. Life is hitting hard, and it's not getting any easier any sooner, but it's okay. I can go on the sleep that I have. I can think about what's going on. I can problem solve. My son still does fill in my sentences for me sometimes. But I think that was just like something that he picked up on. But I can finish most of my sentences on
There's
my
a
own.
difference between mom brain and endo brain, though. There is a
Yes.
mom brain
Yes.
piece, yes.
It
Because you're handling many things at once.
Yes. I wouldn't have been able to do this all. I was not able to do multitasking, is just switching from task to task very quickly, right? I wasn't able to do any of that.
Yeah.
When I look at how I can handle things now, even if I'm not sleeping, it's hard to put into words how I'm excited I am about being able to go through so much stuff right now.
Yeah.
And still just be like, I'm like any other mom with 4 kids and all of this going on. I'm tired at the end of the day. Sometimes I'm sad. Sometimes I want to cry. But it is not my whole body. Just, I am aching from head to toe. I can't figure out anything that's going on. I can't articulate. I can't put anything into words. Your elbows hurt. Your knees hurt. Your stomach hurts. Everything hurts. And you don't know what's wrong. Even to now where I can breathe and I can get myself back into a better place. I couldn't do that before. I couldn't cope with a lot of things. And all of that fell on my husband, which is really hard looking back. Where now we can be as a team and I can say, okay, this is going on, but I can still do this. And that, the fatigue and the joint pain were huge, because just to not even be able to function.
Yeah.
And now I'm fatigued, but it's manageable. I have joint pain, but it's manageable. I can still conquer. I can still do life. I can still pick up my toddler. I can still, because there was a point where I could barely get off my floor. And when I couldn't get off the floor, or the pain would like go through my body, I mean, it would just send me into such a depression. And to go through this recovery process and strengthening process. I was at my chiropractor the other day, and I laid down on the floor. It's like, this is what I do, and this helps with this. And I just popped back up off the floor, and he's like, wow, look at you. And he was like, this is the best I've seen you in like years.
Yeah.
And I was just doing a little dance because that's huge because Kyle Winkler, my chiropractor in Beulah, helped me. He got me through so much on the day to day. Sometimes it was like every other week to every other week. And just to help have some sort of pain relief, to help get some functionality back until I could go on to the next phase of whatever it was. And
It's nice now to only have to go when something comes up, not that's that thriving or surviving, right? Before you had to go weekly, every other week just to survive. And now it's like, yeah, I was planting the garden and I did way too much. And now you can just go in and get a tune up and yeah.
Well, and he books way out and I forget to make, I was like, oh yeah, I need to call back and make the appointment. And then I forget. And if I didn't have an appointment on the books he was really good about saying, Kristina, I can't see you we're not going to schedule you every 2 weeks. We're not going to do this. We'll schedule it every month and we'll go from there. And my appointments were going to be like 7 weeks apart. And I was like, I'm cool with that. Like I'm not living chiropractor appointment to chiropractor appointment. I'm not living PT appointment to PT appointment.
Yeah.
I'm not living scared to move. I'm not living scared to do life. And I can do this. I can play with Evelyn. We can do pony rides.
Wasn't going down the water slide. Wasn't that one of your goals?
Yes.
Right?
Yes.
With Michael here. Yes. And you can do that now.
Yes. Still pretty nervous about that. But I know that I can get there. And I know that even if I get banged up doing it, I don't have to be scared of not being able to function. I can do some exercises. I can do some stretches. I have tools in my toolbox. I can have fun with my kids. I can live life with my kids because that was so hard when you're just exhausted and watching them have fun and they're like, Mom, can you do this? Or Mom, can you do this? Or just never being there because where we live in rural North Dakota, I worked one direction. My husband and the kids went another direction. And there were people that didn't even know I was my kids' mom.
Yeah.
Because I didn't go to stuff because I was at home sleeping.
Yeah.
If I was off, I was sleeping or honestly coming to see you guys.
Yeah. And that's what we talk about. There's afterwards, there's relief, there's joy, but there's anger, there's frustration. And I think one of the biggest things that surprises women after surgery is the grief because it becomes more obvious all the things you missed out on, the things you had to start saying no to so you could just function and what that does do to your marriage, the things your husband has to pick up, what your kids endure, what they sacrifice, right? Like, I think when you're in it, you're just functioning and getting by. And then once you're on the other side of surgery and feeling better, yeah, there's a lot of grief. And I always tell women, but also think of the gratitude that you have this husband that did support you through all of that, and was there for you and allow him to continue to be. And my kids, I still kind of giggle because I felt like they missed so much when I was so sick for a while. But they will say things to me like, remember how fun that was when we got to climb in your bed and play the Shut the Box game? And I was like, glad you think that was fun because I have this like horrible mom guilt that I couldn't even play with my kids. They had to come into bed with me to play with me.
Yeah.
So thankfully, they remember in the light of, hey, remember how fun that was? I'm like, yeah, that was great, guys.
I have one of those with my son because he only did preschool a couple days a week. And so when he didn't and I was off work, he stayed home with me. And so I had so much trouble getting out of bed. I mean, it's not like I just left him to his own devices and stuff, but I was just tired. So my husband would have the applesauce pouches and stuff ready because he'd wake up. I has nothing to eat. And he's like, okay, we got some applesauce pouches. And he'd come into bed with me and we'd play this game where we'd make our hands like mouths and we'd try to grab each other's hands and wrestle around and stuff. And that's still something, if I make like hand motions at him, he is just all over it. That's our special thing. But then remembering he did not consider me awake until I was physically out of bed.
Yeah.
Even if we had been laying in my bed for an hour.
Yeah.
I still wasn't awake until I was physically out of bed. So like you said, that guilt, like I wasn't there for him. But he's remembering the fun. He's remembering the snuggles.
Yeah.
And now with Evelyn, he's a little, you can tell he gets a little jealous
Right.
because she'll be laying in the bed or she'll be like, no, she doesn't want him in our space.
Yeah.
But yeah, looking back at the things that I missed, or just even just like being too tired to be, I don't know, be social, to smile at people, or you like force through it and you just get home and you're exhausted and you don't want your kids to think you hate all the stuff going on.
But you slowly isolate. And then pretty soon people stop asking to do things because you always have a reason to say no,
Yep.
right? And
Yep.
then, yeah, it's fun after when you start to have more energy. I think that happens so slowly that all of a sudden, again, it's like the dimmer switch was put on and all of a sudden you can turn the lights on again and actually feel real joy and go to a social event and not force yourself to be there and force yourself to smile, but you authentically enjoy yourself there.
Yes.
It's just those little things that you don't realize over time that endo can take from you.
Yeah. And with the endo recovery, so Dr. Duke had said you have a window after surgery where you have a void of inflammation. And so it can be easier to get pregnant earlier in that window, even though you just had surgery. So we went for it and we were able to get pregnant, which we were so happy about. And so recovering from the endo, being pregnant at 37, 38, it's just a different ballgame because I have an 18-year-old that we adopted. I have an 11-and-a-half-year-old and a 9-year-old and an almost 2-year-old. So it's like pregnancy's different when you're older. Pregnancy is different when you're recovering from a surgery. And pregnancy is different. My body was just completely falling apart. It was a rough pregnancy. It was rough. After pregnancy, I was like, oh, great, I can move again. I have all this relief. And then I threw my back out and it was just, I can't get better. It was just so hard because I was still recovering from the surgery. I was still pulling myself back together from not having endometriosis and not having somebody else sharing my body. Where are the ligaments going? What are the muscles compensating for?
And you still have a very heavy uterus. It's not happy and pulling on your sacrum all the time.
Yes. And I didn't go to a lot of things with my family because my family lives 2.5 to 5 hours away. And I got a call from my sister and she's like, well, can't you just deal with it? Can't you just come up? No, I can't. If I do this, I'm going to be at home for a week laying on the couch. Like, I'm going to have to ask my 9, 10-year-old at the time to pick Evelyn up out of the bed, out of the cradle, out of the pack and play. I have to ask her to put her on the changing table for me. I have to ask her to help me get up. That's not fair for me to do to my kids.
Yeah.
Well, is it really that bad? And I just broke down crying because to have somebody, my own sister, say that I'm blowing this out of proportion was so hard. And just disheartening to push aside the fact that I had come a long way and we had 3 miscarriages. Finally, we had a miscarriage in February before my surgery because we were like, we're just going to try again before the surgery. Maybe things will happen. It didn't happen. And to then finally have Evelyn was wonderful. But not that it didn't have its struggles. And then to have somebody just say, what's your deal? What's your problem? You just don't want to be around us. And I can't, for my own health, for the health of my family, for me being able to take care of Evelyn, I have to do this for me because I can't keep setting myself back for everybody.
Yeah.
And so that put a lot of strain on things. We're now, okay, we came to Bismarck today. We left our house at 7 Mountain Time. We got up, we got rolling. I feel good. I brought a cooler and a diaper bag and a blanket and a bunch of toys. And I grabbed Evelyn and I walked up a flight of stairs and I didn't think twice about it. Yeah. And I wasn't like, oh my gosh, how am I going to feel at the end of the day?
Yeah.
I'm not worried that I'm not going to be able to get out of my bed tomorrow.
Yeah.
I'm not worried that I'm going to ruin my weekend by doing too much today.
Yeah.
I'm not worried about any of those things. I'm not even worried about the drive. I used to like so much anxiety over the drive. What am I going to feel like when I get home? Am I going to be able to get home? Am I going to have to stop? Am I going to do this? And freedom to move, freedom to live, freedom to not be tied in that place of anxiety, worrying about everything has just been a game changer, because you can't function when you're constantly anxious about everything.
No.
It messes with your mind, it messes with your body, it messes with so many things. And like you said, to just find joy. Evelyn likes to jump on me when I'm doing physical therapy exercises. I'm laying on the floor and she'll just come and just 2-foot stomp into my abdomen. But I can handle it.
Right.
Like, I can handle it. I'm at a place where I'm pretty sure my abs are bruised.
Right.
But I can handle it, and I can get back up off the floor, and I can go and do it. And like you said, that joy, I haven't had that joy. They say some people, you can feel the joy coming off them. I've rarely been that person that, does it give joy or share joy? I'm not generally that person that can do that, because I rarely ever had joy until the last year or so here.
Yeah. And you can see it in me, honestly. And I think that's where it's so important, ladies, to find practitioners who do truly understand endo, because I remember the situation with your sister. And when you're telling me, it's good to have a provider or a friend who gets it, that says, no, you do have to make this choice for you, because they don't understand the level that your body will go to. You've been there and you know better, and you don't want to go there again. And even with the appointments, we know that you had to drive a ways. And there were times you're like, I don't know what to do. And I'd say, listen, I know you're in pain, but really think about it. Even if you come here, we get things aligned, we do some visceral stuff, we calm it down. The state you're in right now, we're going back, undo what we did. Then is it really worth it? Right? Again, not that I didn't want you to not come, but just that there were times where it was like, okay, stress of the drive, the weather, coordinating kids, right? Like it's really important to have people in your life that understand that piece of it, because it is. If you've never, I would say it's kind of like the person who doesn't have kids at all, who thinks they're really busy. And then once you have kids, you're like, oh my gosh, what was it? Like you only know the busy you know, right? You only know the pain. You only know the suffering you've been through, like to that limit. So just for those of you out there with endo, just again, you probably endure a lot more than you realize. And so be gentle with yourself and validate that. And it's okay to say no to things.
Yes. It's interesting you say that, because I was seeing Elizabeth Almendinger, the naturopath in Bismarck here. And but a naturopath here in Bismarck. And we're trying to get a gauge on my stress level. And I'm like, she's like, are you stressed? Yeah, I think so. And she's like, I think you need to see somebody to help. We kind of talked, and it's like, I need to see a therapist or somebody to see, am I overreacting? Am I, if A happens, is B happening or is Z happening? Like, where am I on the stress response? And even when I went to see somebody, they were like, well, you can't compare yourself and you can't do this. And I'm like, I feel like you can tell me that if this happens and I start bawling, is that an appropriate response? And this person wouldn't help me gauge how stressed I was. Well, now what do I do? If I can't, if no one can help me tell if I'm stressed or if my stress is appropriate, well, where can I even go from there? I was really, I couldn't handle anything.
Well, and with endo, like we say, right, it's like your nervous system is so upregulated. So essentially, it's like you have been in the car with the most annoying people ever for 2 hours and you are ready to freak out. That's how your nervous system is. Instead of you've been in your own quiet space and something happens, you can handle it, right? So there is that, upregulation that is out of your control.
Yes. Looking back, there were times where it's like something would happen and I would just lose it. And then, it just seems like you're a drama queen and this. And looking back, no, I wasn't being a drama queen. I wasn't trying to cry. I just couldn't handle anything. I didn't, even if I've been doing the breathing exercises and all of that, it's like Dr. Mike has that little piece of paper or his little scale thing where your pain is. If you're always in pain, it doesn't take much more pain to have your body freak out and you have an actual pain response and the hormones and all the things. And just when your anxiety level is that high, that was so hard to be in a place where it was like, why can't I respond like other people? Why can't I handle this? Am I dramatic? Is there something wrong with me as a person? Am I awful? Am I just a really mean person? And so to be in that, we're doing this winding road, but it is really, to think it's all tied to the endometriosis and how it just exacerbated every hard time of my life.
Yeah.
Because I am an anxious person. That's the way I'm type A. I like everything the way it is, but not being able to cope with anything.
Yeah.
And how it affected the people I hung out with, the activities I did or didn't do. Even like we're talking high school, college, things like that. How I planned my life around my period. How I didn't know how inflammation cycles work and like how much sugar has an effect on things and how much extra strain it caused in every single relationship. It's mind-boggling, but it's so encouraging too, because I know that I can, now that I'm there's still inflammation, there's still stuff going on, but to be able to see, okay, there's all these pieces and now I can start arranging them. And you guys have been so amazing in helping me put those pieces together of how to get back on track. Because I remember, was it in last August, or maybe it was earlier in the summer, you're ready to see Michael. You're ready to see Michael. And that was maybe one of the hardest parts of all of this, was like having to figure out the next step on my own. And you're like, okay, this is in a good place, or is as good as this going to be? Now you're ready for the next step. And we went to the next step. And in 5 months, so many things changed. And I mean, I think he'll be the first one to say it's not like he's magic or anything.
But your body was ready to be loaded and it was ready to be challenged. Where honestly, before surgery, that would have wrecked you. Not wrecked you it would have been too much. You would have been exhausted. It would have been hard to stick with it. It would have caused more pain. So it would have been very hard to even continue with it. Where you were at the point where things are as stable as we can get them. But now we need to stabilize and load and challenge, and you could handle it.
Yes. And for him to say, it's so funny, you go to physical therapy to get a lesson on mindfulness. And for him to say, take a minute and celebrate where you're at. And then as we went on, take a minute and just think about how things have changed. And then take a minute or 5 minutes to acknowledge, okay, you're in pain. You reached too far. You picked something up that was too heavy. He's like, you're in pain, but it's okay. We have a plan. I strained my back. I'm going to lay on the couch and use an ice pack. I'm going to go for a walk. And I'm going to be okay. And just to be so all of those pieces coming together and not being afraid. Wow, just how it's changed my life, because I'm not living in constant fear of. I mean, I'm still scared about when anything's icy. I'm still super scared to walk on the ice.
Valid.
But I'm not scared to just go run around in the yard. I'm not scared to awkwardly pick up a toddler. Or now that she's in that stage where she will throw tantrums, and we call them daddy. Daddy games. There's daddy games and there's mommy games. And I don't play daddy games, but I can if I have to, which is a great feeling, because she's busy and active and she likes to jump and she likes to jump off of things. And to be able to be there for her. She fell off her bed. I was like, no jump on the bed, no jump on the bed. And she got too close to the edge. The blanket was slippery, fell off the bed. And I reached and scooped her because she's crying. I was like, oh my gosh. And I could feel I had done too much. I said, it's okay. It's okay. We got it. And then the next day I was like, okay, I'm a little bit sore. But I got it. We're good.
Such a good place. And the joy. Like, honestly, there's just a different joy in you, which it's been fun to see these stories. And some of these women, I've gotten to see you here and there, but some women I haven't seen in years. So it's fun to see just the light right? This,
Yes.
the relief, the joy, instead of
Yes.
this, ugh.
Yes.
So, go ahead.
Oh, I put in our Christmas letter this last year or this last Christmas here, that I was bragging about that I could shuffle
Yeah.
playing defense against my 11-year-old because she's as big as I am.
Yeah.
And we homeschool the younger kids, and we were playing basketball, and I just shuffled. I used to play basketball, and I just shuffled, and it was okay.
Yeah.
And I haven't been able to engage with her like that in a long time without being like, hey, you're gonna hurt me. You're gonna hurt me. You can't do that. And sometimes she has hurt me. And just how that's able to broaden, deepen my relationships with my kids. Kids are physical creatures. They need that push and shove as much as they need the hugs and snuggles, right? And it seems silly to brag about something so simple in my Christmas card,
but it's huge. I remember when my son was 5 when I had my surgery, and that summer, I had surgery in February. That summer, we were out playing football, and normally I'd play catch a couple times, and I'd go sit and watch him and say good job. And not even realizing it, I started playing with him and roughing around with him, and he stopped and goes, "Mom, you're playing with me." And I usually not a huge crier. I like started just tearing up. So it was like, it's a huge success that you didn't even realize. So when you're like, oh my gosh, I just shuffled with her and I didn't fall, I didn't hurt myself. And she has more joy because you're being childlike and
Yes.
playing with her. And
Yes.
yeah, it's those things that, again, you don't realize were slowly robbed from you.
Yes. Yes.
Yeah.
It's not till you stop and look, and hopefully too, it's like for people that are looking at the situation that are like, is this like really how bad she was? And yes, yes, I was told at different points, you probably shouldn't run because your body can't handle that kind of motion. It's just not prepared for that kind of action. And to now be like,
No, my body is made to run. It can do it.
It can do it. I can jog around the yard
Yes.
on an uneven surface.
Yeah.
And I can even throw a ball while I'm running across an uneven surface. And two, being able to cope with the things. Was that really that big of a deal? It's like, yes, it is. And I don't care what you say. I'm really happy about it.
Yes. So if you could sum up for women, what's one thing you wish that women knew about endometriosis?
Oh, if there's one thing. Oh, I wrote down like all sorts of things. But don't be afraid to acknowledge what you have going on. Because I was like, well, I can get through. Don't be afraid to take a good hard look and say, this is what I have going on. This is hard. And write it all. Don't be afraid to write it all down. And don't be afraid to feel guilty about laying it all out there. And don't feel guilty about saying to your doctor that you've been with forever, this is what's going on. And if they can't help you, don't be afraid to know that you have stuff going on and that maybe the people that are currently around you aren't the ones to help you.
And again, that goes to our endond.com website, the Build Your Team. That is not every person in North Dakota that can help with endo because we're still trying to build that. But the people listed on there are practitioners who have extensive knowledge and do understand the disease. Yeah. So thank you so much for sharing your story.
Thank you for having me. Thank you for everything you and your team do, because when we look back on it, I'm going to start crying. I am never afraid to overshare anymore because people ask questions and it's like, I never thought a hemorrhoid procedure would change my life. But if I hadn't come here, I wouldn't have a better marriage. Even though like we have all this stuff going on and things are still hard, I can be a partner to my husband. I can be a mom to my kids. I was able to have another kid, which we didn't know if we were going to be able to, and she's amazing and she's so funny. And not that having kids when you're older is necessarily like the easiest thing, but she brings such a joy, and I'm able to experience all of those things without being afraid. And I can truly just enjoy life.
Yeah.
And it never would have happened if I hadn't come here, because I was doing everything I could do.
And you were. Yes.
And it was never going to be enough because I didn't know what I was actually dealing with.
Yeah. You're welcome. You're welcome. This is like the honor we get to journey with women in this. And even though it's a hard journey, it takes a lot of convincing sometimes. But yeah, it's so, like I said, these have been such fun interviews to sit with women that I have seen at their worst and their darkest hours sometimes. And to see this light and joy in them has been like amazing for me. To reminds me, because we all have bad days or days where I'm like, I'm even a good therapist. I don't even know what I'm doing. And it's been really fun to have these interviews to say, okay, there's been some good in there, right?
Yes.
So yes.
So much good. So many lives changed in little ways that lead to big things.
And hopefully the butterfly effect, right? Like you then recognize it in others. You then can help be there for others. And we are working on trying to find a way to safely do a database where if someone requests to talk to somebody, we can give them a stat sheet. Do you want to talk to somebody who had it at this age with kid, So yeah, ladies, watch for that. Hopefully someday we'll get that going.
Yeah.
But thank you again for being here with us and sharing.
Thank you so much for everything you've done for me.
You're welcome.